Hello and welcome. Today, we're diving deep into a lung disease called hypersensitivity pneumonitis, also known as extrinsic allergic alveolitis. It's a mouthful, but understanding this condition is crucial for anyone concerned about respiratory health. We'll explore what causes it, how it affects the lungs, and what can be done about it. So, what exactly triggers hypersensitivity pneumonitis? The key lies in repeated inhalation of specific organic dusts, molds, bacteria, animal proteins, or certain chemicals. Think of it as an allergic reaction in the lungs. Common culprits include moldy hay, bird droppings, humidifier water, and even certain types of mushrooms. The specific trigger determines the type of hypersensitivity pneumonitis a person develops. For example, farmer's lung is caused by moldy hay, while bird fancer's lung comes from exposure to bird proteins. Now, let's look at what happens inside the lungs when these substances are inhaled. The repeated exposure triggers an abnormal immune response in the small air sacs of the lungs called alveoli. This immune response isn't the typical defense mechanism. Instead, it leads to inflammation. This inflammation causes the alveoli walls to thicken, impairing gas exchange. In severe cases, this can lead to scarring or fibrosis of the lung tissue, making it difficult to breathe. Hypersensitivity pneumonitis isn't a rare disease, but accurately determining its exact prevalence is challenging. This is because it can be difficult to diagnose. It affects people of all ages, but it's most commonly seen in adults who are regularly exposed to the triggering agent in their occupation or hobbies. Certain occupations, like farming, poultry keeping, and mushroom cultivation, are associated with a higher risk. The signs and symptoms of hypersensitivity pneumonitis can vary depending on the form: acute, subacute, or chronic. The acute form presents with sudden onset of cough, shortness of breath, fevers, and muscle aches, usually starting a few hours after exposure. These symptoms typically resolve within days if exposure is avoided. The subacute form develops more gradually over weeks or months, with progressive shortness of breath, fatigue, and a persistent cough. The chronic form develops over months or years and is characterized by progressive shortness of breath, chronic cough, weight loss, and fatigue, ultimately leading to pulmonary fibrosis and irreversible lung damage. Diagnosing hypersensitivity pneumonitis can be complex, often requiring a combination of methods. First, a thorough medical history, including occupational and environmental exposures, is crucial. Physical examination, listening to the lungs for characteristic sounds, is also important. Lung function tests such as spirometry can reveal restrictive patterns. A chest, Ray, or CT scan can show characteristic patterns of inflammation or fibrosis. Bronchoalveolar lavage, where fluid is collected from the lungs for analysis, can also be helpful in identifying the presence of specific immune cells. In some cases, a lung biopsy may be necessary to confirm the diagnosis. While there aren't strictly defined types of hypersensitivity pneumonitis in terms of distinct disease entities, the condition is often categorized based on the specific trigger and the duration of exposure, as we've discussed with acute, subacute, and chronic forms. Identifying the specific triggering agent is crucial for effective management. The cornerstone of treatment for hypersensitivity pneumonitis is avoidance of the triggering agent. This may involve changing jobs, modifying hobbies, or improving ventilation in the home or workplace. In many cases, this is enough to allow the lungs to heal. However, if symptoms are severe or lung function is declining, corticosteroids, such as prednisone, may be prescribed to reduce inflammation. In severe cases, oxygen therapy or pulmonary rehabilitation may be necessary to improve breathing and quality of life. The best way to prevent hypersensitivity pneumonitis is to minimize exposure to known triggers. This can involve using respiratory protection, like masks in high-risk environments, ensuring adequate ventilation in buildings, and properly storing and handling organic materials to prevent mold growth. Regular cleaning and maintenance of humidifiers and air conditioners can also help prevent the growth of harmful microorganisms. The prognosis for hypersensitivity pneumonitis varies depending on the severity and duration of the disease. In acute cases, complete recovery is possible with prompt diagnosis and avoidance of the trigger. However, chronic exposure can lead to irreversible lung damage and a poorer prognosis. Recent research is focused on developing more sensitive diagnostic tests and identifying new therapeutic targets. Studies are also exploring the role of genetics and individual susceptibility in the development of the disease. Ongoing research offers hope for improved outcomes for individuals with hypersensitivity pneumonitis.